Okay, no, I'm glad that we have launched our vaccination on the COVID-19 site here in George for the Southern Cape today. We have the cluster commander of the Gamas Corps, Brigadier Satiana, present, and then we also have the provincial commissioner's representative, Brigadier Van Wyk, who has also joined us today. We've invited all the senior managers so that they can be first in line, that we can encourage our members to also get vaccinated. If we look at what is happening out in society, around the world, social media specifically, there's a panic created through false information, incorrect information, fake news, also conspiracy theories about this coronavirus, the so-called COVID-19. We can see that it is impacting negatively with the number of deaths that are occurring in this country and around the world. The latest figures that I saw this morning, for South Africa, we've had 70,000 deaths as a result of coronavirus. And this weekend, Brigadier Satiana and I were in Pedi in the Eastern Cape. We buried Colonel Matole, our support head from Oudtshoorn Police Station. As we drive back, we get a message of Captain Jumat of the Gamas Corps cluster that also succumbed to this coronavirus and COVID-19. So, there are various categories of people in terms of how they are affected with this virus. The first are those people that haven't got it as yet. The second are those who got the virus, but they had no symptoms. The third are those who got the virus, had symptoms. Some had to go into isolation, others had to be hospitalized. The fourth are those who recovered as a result of medication and boosting the immune system, etc. But the last category are those that actually did not make it, that succumbed to this virus. If we look at nationally within the SAPS as an organization, we have had 147 deaths so far for the financial year. And in the Western Cape itself, our figure now stands at 10. So it's no longer just statistics. It is now real. It is people we know. It's our family. It's our loved ones. It's our colleagues. And we as the South African Police Service are here to protect and serve the nation. Therefore, it is important that we vaccinate, that we have a chance of surviving if we contract this dreaded disease during this pandemic. There are 63,836 SAPS members who have been vaccinated so far in the organization. The Western Cape alone is 8,578 that has been vaccinated. Our statistics is frightening in terms of those who are positive. We're standing at 649. Those who are in isolation currently are 312, and there are 19 in hospital. So this impacts negatively on service delivery to the community, when our police stations have to be closed and we need to have minimum personnel deployed as a result of the increase in sick leave and those that are positive and in isolation as a result of this. PolMed and the Department of Health have come together with the SAPS management and made these special arrangements. So I want to appeal to all our personnel and their families in the Southern Cape to make themselves available. Our site is opened officially today. It will run for the next 5 days until Saturday. Our priority is our personnel that we will be focusing on during the mornings from 8 o'clock until about 2 o'clock. And thereafter, the family members, they need to register and thereafter come through and get the vaccine. There are many people who are afraid about the side effects, etc. The system runs so effectively that they've got qualified nurses, they are trained counselors, our EHW are also present. We are here to support the members. I have taken the vaccine, Brigadier Satyana has taken the vaccine, Brigadier Van Wyk has taken the vaccine, and we have survived it. Our chances of survival are much better by taking the vaccine than us not taking the vaccine. So I want to make an appeal. We see that we are on lockdown since March of last year. I want to make an appeal to all members to take the vaccine and ensure that we are safe so that when we can engage and interact with the communities out there, when we're investigating cases, when we are making arrests, when we are serving people at the community service center, that we are not a risk to other individuals by protecting ourselves and ensuring that we take the vaccine. So my appeal to all our personnel and the community at large, every single person that is at the age where you can take the vaccine, to get to the nearest vaccine site, register yourself, get the vaccine, and your chances of survival are much better than without the vaccine. Thank you, and God bless us all.